Welcome to a very important special on women's health. I'm Robin Smith. The American Heart Association and the Go Red for Women movement raise women's awareness of heart disease and help them learn their personal risk for the #1 killer of women over the age of 25. In the next half hour, we'll provide you with the tools to take action and reduce your personal risk for heart disease. Joining me now in this effort is Dr. Jane Chen from the Washington University Heart Care Institute at Barnes-Jewish Hospital.
Cardiovascular disease claims the lives of over 480,000 women each year, about a death a minute, and that's 17 times as many women that die from breast cancer. In fact, more women die of heart disease than all cancer deaths combined. What you need to take away from this special is that there are specific things you can do to reduce your risk of heart disease, but you need to see your doctor and find out what your risk factors are.
This information is so critical to your health that we do not want you to wait to have your questions answered. So, throughout this program and until 8:30 this evening, experts from the Washington University Heart Care Institute at Barnes Hospital are available to take your questions. Call 314-TOP-DOCS. Staff members are available to answer general medical questions about your heart health. Or you can go to your computer and log on to www.barnesjewish.org right now for a free heart risk assessment.
We're going to discuss the risk factors for heart disease, both those that you can change on your own and those that you can't. We begin with Dr. Angela Brown and a frank discussion of cholesterol, high blood pressure, and diabetes.
When we talk about cholesterol, it's actually a waxy substance that's very important for cell health, and it's part of what makes up the cells in your body. The problem is your body makes cholesterol, but then you also get cholesterol from what you eat. When there's too much cholesterol, that's what puts you at risk for having heart disease. That cholesterol builds up in the blood vessels and can lead to blockage. When you talk about the cholesterol numbers, you want to have a total cholesterol that's less than 200. The HDL cholesterol, for women in particular, you'd like to have greater than 50. The LDL cholesterol is actually going to vary depending on what your risk factors are. For most people who do not have significant risk for heart disease, it's going to be less than 130. However, if you're diabetic or if you have some evidence of heart disease already, then you want your LDL cholesterol definitely less than 100, and for some people, less than 70. Talk to your doctor and get your cholesterol level checked. Everyone should have a baseline cholesterol by the age of 20. If it's okay, then you should have one every 5 years. I like to describe high blood pressure as sort of like thinking about a water pump and a water hose coming from the pump, where the water pump is actually your heart and your blood vessels are the water hose. And if you know, when you leave a hose outside in the yard, that hose gets damaged. The same thing happens when there's high blood pressure. When there's continued pressure against those blood vessels, then you get abnormal function of the blood vessels. And that's what leads to the diseases. A person is considered to have hypertension if their blood pressure is greater than 140/90, where 140 is the top number called the systolic blood pressure and 90 is the diastolic blood pressure. The scary thing is that most people do not have symptoms of high blood pressure, but high blood pressure by itself is an independent risk factor for cardiovascular disease. And what that means is that without having high cholesterol, without having diabetes, without being a smoker, high blood pressure alone increases the risk of having a stroke, having a heart attack, developing heart failure. So it's a very important thing to know. And everyone should have their blood pressure checked at least once a year. Get your blood pressure checked, and clearly if your blood pressure is over 140/90, it definitely needs to be treated. But even if it's less than that, everyone should be engaging in important lifestyle modifications, exercising, watching their diet, watching their salt, watching their alcohol. Diabetes is a disease of abnormal glucose utilization by the body, meaning that the body cannot use the sugar that we put in properly. And you can classify it as two types. Type 1, which used to be seen primarily only in children where the body did not make enough insulin to take up the glucose. And then there's type 2, which used to be called adult onset diabetes, where the insulin is there, but it just doesn't work properly. Diabetes is a major problem in our country, and it's continuing to increase. It's estimated that over 16 million adults have diabetes. The sad part is that only about 11 million or so actually know that they have it. So you're talking about 6 to 7 million people walking around with it, and they don't know it. The important thing really is to know your risk factors for diabetes. Family history is very important. If your mother, father had diabetes, if you're overweight, and diabetes actually mirrors the obesity epidemic that we're seeing in this country. As we're getting larger, the number of people with diabetes is increasing. Also, people who are less physically active are going to be at risk for diabetes. So if you fall into any of those categories, your risk is going to be higher. The most important thing is to see your doctor and to get screened for diabetes.
And once again, we want to remind you that if you have any questions about cholesterol, high blood pressure, or diabetes, you can call 314-TOP-DOCS right now and talk to an expert from Washington University Heart Care Institute at Barnes-Jewish Hospital. A lot of that was frankly scary, but what Dr. Brown was talking about is actually the risk factors that we can modify, right?
Absolutely. And that's why this information is so important. If you are willing to speak with your doctor and find out your blood pressure, your cholesterol numbers, and get a diabetes screening, you can make changes in your life to help prevent heart disease.
Dr. Brown also spoke about lifestyle modifications, exercise, watching your diet, watching your salt intake, and also watching your intake of alcohol.
And these are very simple things that everyone can do to improve their health. But for those at higher risk, it's essential that they change their lifestyle to reduce their chance of heart disease.
Not until I walked in the door of the hospital and they told me it was my heart. Heart never entered my mind. Had I gone when I first started having those angina pains, they would have stopped the heart attack immediately and there wouldn't have been any damage to the heart muscle. It's just paramount that you have it checked out immediately upon having any of these symptoms. My quality of life is 100% different because I didn't realize that I was feeling sluggish. You know, I'm flying pretty high right now emotionally.
Welcome back to Go Red for Women, presented by the American Heart Association. We began this show with the 3 risk factors which you can modify: cholesterol, high blood pressure, and diabetes. The next 3 risk factors that you can modify for heart disease are smoking, obesity, and physical activity.
And it's important to note that these are all critical factors to your cardiac health, but they can all be modified by you. You have to see your doctor and find out your personal risk factors for heart disease.
And remember, you can have your general medical questions about your heart health answered live by an expert from Washington University Heart Care Institute at Barnes-Jewish Hospital. Simply call 314-TOP-DOCS.
The data to support the risk of smoking and heart disease is overwhelming. Smoking clearly causes heart disease. For women, even more so than men, the average life expectancy for a woman that smokes is 15 years less. About 60% of people who come in with a heart attack are active smokers. We know that if you quit smoking on that day and take that as a life-defining event to quit smoking, then again, as I said before, your risk of heart disease is cut dramatically. Also though, if you have heart disease and you continue to smoke on top of that, then your likelihood of having another heart attack is on the order of 50 to 70% higher. If you quit smoking now, over the course of a year, your risk of having a heart attack is cut in half. And if you continue to quit smoking over 15 years, then your risk of heart disease goes away almost entirely, as if you never smoked at all. Smoking makes other risk factors worse. So smoking also can cause hypertension or high blood pressure. If you have a family history of heart disease, smoking on top of that family history makes your risk of heart disease even higher as well. On that list of treatable risk factors, smoking, obesity, physical inactivity is right up there. On a relative risk basis, so if you take people who exercise and people that don't, the people that don't exercise are at just as great a risk as the people that smoke compared to the people that don't smoke. So if you don't exercise, your risk of developing heart disease is much higher than if you do exercise. In addition to smoking, we know that obesity and smoking are 2 of the most modifiable or treatable risk factors for heart disease. When we consider the risk of obesity and heart disease, we realize that when we look at women over 60, 50% of women over 60 are overweight. That is, their body mass index is more than 25. and 30 to 40% are actually obese, or their body mass index is over 30. Obesity is important as a risk factor for heart disease for several different reasons. One, it actually increases your risk of developing diabetes. It increases your risk of having high cholesterol, and those factors, as well as the increased risk for hypertension, help contribute to heart disease. There are different ways to approach obesity. Ideally, you just have to burn more calories than you take in, but that's not easily done. People that try to go on fad diets or crash diets to lower their weight generally get frustrated, and those people end up rebounding and gaining weight. So I really encourage patients to avoid the fad diets.
Speaking of obesity and weight loss, the Washington University Heart Care Institute, together with Barnes-Jewish Hospital, has a very successful weight loss program called Way to Life.
And this is a medically directed weight loss program. They set individual goals for weight loss, blood sugars, cholesterol, blood pressure, and energy and fitness levels. And all the lab work is included.
And it's open to anyone who would like to lose weight. Learn how to make healthier food choices, learn to exercise, and modify the behaviors that increase your risk for heart disease.